Have you ever pondered about the significance of community health and well-being in our lives? This question is more profound than it may initially seem, as the essence of community health is deeply rooted in the intricate web of our everyday existence. Community health is a vibrant tapestry woven with the threads of individual health and well-being, societal progress, and the overall vitality of our shared spaces. It's not just about each of us being healthy in our own right, but about the collective wellness of all of us together. From the air we breathe, the parks where our children play, to the local businesses that sustain our economies, each component plays a vital role in the overall picture of community health. Now, let's take a moment to consider strategies and policies designed to enhance health outcomes at a community level. These are not created in a vacuum, but are informed by the most current evidence base. They encompass inclusive community development approaches that aim to improve the health and well-being of communities. These strategies consider the defining characteristics of different communities, including cultural and faith-based factors. They aim to address health inequalities and improve health outcomes, forming an integral part of our efforts to create healthier, more equitable societies. But it's not just about having these strategies and policies in place. It's also about implementing them effectively, taking into account the local demand on services based on health needs. This includes understanding the different public and voluntary sector services available in the community to help meet these needs. Central to this process is the evidence base. It's the bedrock upon which strategies, policies, and interventions are formed to improve health and well-being. It's crucial to consider how cultural and faith-based differences can impact the implementation of these evidence-based interventions. As we delve into this topic, consider how your community's health might be enhanced. Reflect on the strategies and policies in place in your community and how they contribute to promoting health and well-being. Because at the end of the day, the health of our community is the health of all of us. Communities come in various forms, each with its defining characteristics. Picture a vibrant tapestry woven with threads of shared values, cultural practices, and common beliefs. Each thread represents a community, and each community is unique, differentiated by its own cultural and faith-based factors. Consider, for instance, a community defined by its geography, a neighborhood, a city, or a rural area. The health needs and resources in these communities can differ greatly due to factors such as population density, availability of healthcare facilities, and environmental conditions. Alternatively, communities can be defined by shared cultural or ethnic backgrounds. The health outcomes in these communities can be influenced by traditional practices, beliefs about health and illness, and dietary habits. For example, certain cultural communities might prioritize holistic or alternative approaches to health, which can shape their health behaviors and outcomes. Faith-based factors also play a significant role in shaping communities. Religious beliefs can influence a community's attitudes towards health, illness, and healthcare. For example, some faith-based communities might have specific dietary restrictions or practices that influence their health outcomes. Moreover, these defining characteristics of communities don't exist in isolation. They intersect and interact, creating complex dynamics that can both challenge and enrich our understanding of health and well-being. For example, A faith-based community within a specific geographical area might have specific health needs that are different from the broader population. These various factors, geographical, cultural, and faith-based, can impact the implementation of health strategies. A one-size-fits-all approach doesn't work when it comes to community health. Strategies need to be tailored to the specific needs and characteristics of each community, taking into account their unique cultural and faith-based factors. Recognizing these variations is the first step towards building effective health strategies. It's about understanding that each thread in the tapestry of communities carries its own story, its own challenges, and its own strengths. And it's these stories, challenges, and strengths that shape the health and well-being of our communities. To illustrate, let's explore a case study that showcases the power of community health strategies. Consider a community, let's call it Hopeville, known for its rich cultural diversity, but also grappling with significant health disparities. High rates of obesity, diabetes, and heart disease were rampant, not to mention the mental health issues that often went unaddressed. The health needs were diverse and pressing, and the local demand on services was overwhelming. In response, healthcare professionals and community leaders came together to devise strategies and policies tailored to Hopeville's unique needs. They began by seeking the most up-to-date evidence base that could inform their approach. They delved into research, analysed local health statistics, and studied successful initiatives from similar communities. It was clear that an inclusive, community-centred approach was needed. The strategies they developed aimed at improving health outcomes and addressing health inequalities. They included implementing community-wide health education programs, promoting physical activity through public events, and bolstering mental health support by partnering with local charities. But Hopeville's cultural diversity posed a challenge. With different cultural and faith-based practices, a one-size-fits-all approach was not going to work. The strategies needed to be adapted to respect these cultural differences. So they engaged with community members, cultural leaders, and faith-based organisations to ensure the strategies were culturally sensitive and inclusive. The impact of these strategies and policies was profound. The community saw a decline in obesity rates, better management of diabetes, and an increased awareness of mental health issues. People started to make healthier choices from diet to physical activities, and they felt more supported when dealing with mental health challenges. But the transformation went beyond numbers. There was a shift in the community's attitude towards health and well-being. Health was no longer seen as an individual issue, but as a collective responsibility. The community was empowered, and people felt more connected, not just to their own health, but to each other's well-being too. This journey wasn't without its hurdles. It required time, resources, and relentless dedication from all involved. But the outcome, a community that was healthier, happier, and more resilient. This case study exemplifies how understanding and addressing community-specific needs can lead to remarkable health improvements. It shows that by using evidence-based strategies and policies, and by considering the cultural and faith-based factors, we can create healthier communities. And most importantly, it underscores the power of community in transforming health and well-being. Strategies and policies play a crucial role in improving health outcomes and addressing health inequalities. They are the guiding maps that lead us towards a healthier, more equitable society. And let's delve into what these strategies and policies look like, both on a national and local scale. On a national level, we see strategies that span across the entire country, aiming to improve the overall health of the nation. So these strategies are often broad, encompassing a wide range of health concerns, such as mental health, chronic diseases, and preventive health care. They also take into account the health needs of different communities, be it cultural or faith-based, ensuring that every citizen, regardless of their background, is accounted for. Then we have local strategies and policies, those that are tailored to the unique needs of specific communities. These strategies are more targeted, focusing on the specific health concerns of a community. For instance, in a community where obesity is prevalent, local strategies might include promoting physical activity and healthy eating. As we navigate through these strategies, it's essential to remember that every community is different. Each one has its own unique defining characteristics, influenced by cultural and faith-based factors. Hence, a one-size-fits-all approach would not work. The strategies and policies must be flexible and adaptable, capable of catering to the diversity of our communities. Moreover, these strategies and policies are not static. They evolve over time, guided by the most up-to-date evidence base. This evidence informs the creation of inclusive community development approaches that aim to improve the health and well-being of communities. By using evidence as our compass, we ensure that our strategies are effective and impactful. In conclusion, national and local strategies and policies are not just about addressing health issues. They are about promoting health and well-being, about creating a society where everyone has the opportunity to live a healthy life. These strategies and policies are vital tools to promote health and well-being at a community level. They are the stepping stones towards a healthier, more equitable future. Addressing health needs at a community level requires a comprehensive network of services. This network should include a variety of public and voluntary sector services, each uniquely positioned to meet specific health needs within the community. Let's start with public services. These are government-funded initiatives aimed at providing essential health services to the community. They are often the first port of call for individuals seeking medical attention, offering a broad range of services from preventative care to treatment for acute and chronic conditions. Public health services play a critical role in executing health strategies and policies at the community level. They are the frontline warriors in the battle against health inequalities, striving to ensure everyone has access to the care they need, irrespective of their socio-economic status. On the other hand, voluntary services are typically run by non-profit organisations and rely on the goodwill of volunteers to operate. These services often fill gaps left by public services, reaching out to marginalised communities and providing specialised care. Voluntary services may include support groups, health education initiatives, or home care services for the elderly and disabled. They are particularly effective in addressing the health needs of specific demographic groups, thereby complementing the broad spectrum approach of public services. Both public and voluntary services are integral to the implementation of health strategies and policies. They provide the hands-on, concrete action that turns policy into practice. Whether it's a public health nurse administering vaccinations or a volunteer delivering meals to the elderly, these services bring health strategies to life in the community. But it's not just about individual services operating in isolation. The real magic happens when public and voluntary services work together, complementing each other's strengths and compensating for each other's weaknesses. This synergy, this cohesiveness, is what truly makes a difference in community health outcomes. It's a bit like a jigsaw puzzle. Each piece is important, but it's only when they all come together that the full picture emerges. The synergy between these services and health strategies is what truly drives community health improvement. Evidence isn't just important, it's fundamental to improving health and well-being. The foundation of any effective health strategy lies in the richness and reliability of the evidence it is built upon. Evidence is the compass that guides our decisions, the map that charts our course, and the measure that validates our progress. It is the cornerstone of our understanding of health needs and forms the basis of our response. In the realm of health strategy, evidence can be likened to a mosaic of diverse pieces, each representing a unique aspect of a community's health profile. These pieces could be epidemiological data, reports from local health services, or findings from academic research. When assembled, they provide a comprehensive picture of the health needs and challenges a community faces. Evidence shapes our strategies, policies, and interventions, ensuring that they are tailored to meet specific community needs. It prompts us to ask the right questions. What are the prevailing health issues in our community? What factors contribute to these issues? And most importantly, how can we address them effectively? Health strategies that are evidence-based are not only rooted in reality, but are also adaptable. They can evolve with changing circumstances, ensuring that the interventions remain relevant and effective. As new evidence emerges, strategies can be refined, policies can be adjusted, and interventions can be recalibrated. Moreover, evidence allows us to evaluate the impact of our interventions. It helps us to discern what works and what doesn't. It empowers us to learn from our successes and our failures and to continuously improve our approach. Let's consider cultural and faith-based differences, for instance. These factors can significantly impact the implementation of evidence-based interventions. By using evidence to understand these nuances, we can tailor our strategies to respect and accommodate these differences, thereby enhancing the acceptability and effectiveness of our interventions. In essence, evidence is not just about facts and figures. It's about people, their health and their well-being. It's about understanding their needs, their challenges, and their aspirations. It's about making informed decisions that can make a real difference in their lives. With evidence at the core, health strategies become more effective and impactful. As we conclude, let's revisit what we've discussed today. We began by exploring the essence of community health, which is the cornerstone of a healthy society. The health of a community is shaped by numerous factors, including the physical environment, economic stability, and access to healthcare services. It's about more than just individual health. It's about the collective well-being of all members of a community. We then delved into understanding communities, as each one is unique with its defining characteristics. including cultural and faith-based factors. These factors play a crucial role in shaping the health, behaviours and outcomes of community members. By acknowledging and respecting these differences, we can foster an environment that promotes inclusivity and health equity. Next, we discuss the role of national and local strategies and policies in improving health outcomes and addressing health inequalities. These strategies are not one size fits all, but are tailored to the specific needs of each community. They are created with the goal of providing all community members with the opportunity to make choices that allow them to live a long, healthy life, regardless of their income, education, or ethnic background. We also highlighted the importance of public and voluntary services in meeting the health needs of the community. These services, which range from healthcare provision to health education, are instrumental in promoting health and well-being at a community level. Lastly, we emphasised the role of evidence in strategy formation. The most effective strategies, policies, and interventions are those that are informed by the most up-to-date evidence. This evidence base allows us to understand what works for whom and under what circumstances, thereby enabling us to implement actions that truly make a difference in the lives of community members. Remember, promoting health and well-being at a community level is a collective responsibility. How will you contribute?